Two formulas for internal abscess. Abscess in viscera. So Jing Tang and Huang Tang. Jing is lugan, but aerial part. Technically we say aerial part, upper part. Because we believe the upper part goes to upper in our body. So that is the reason we use Jing when we try to treat lung. So it treats lung, respiratory system. So it treats toxic heat in lung and lung abscess. So heat type of respiratory symptoms like a phlegm, yellow, sticky, sometimes blood, and abscess with pus. So Jing Tang treat those heat type of respiratory symptoms. And second composition, clear heat with lugan and release dampness with dongguaji and yiren. Okay, dongguaji, winter melon seed, and yiren is commonly used to release the dampness. So it is one of the most commonly used herb for obesity. So Huang and yiren commonly combined. And dispel stasis with tauren. This is Jing Tang. And removing stasis herbs commonly combined with those removing dampness and clearing heat herbs when we treat the abscess in the skin or viscera, wherever, because there is a swelling. So baichu, zhangchu, those herbs are used just like dongguaji and yiren, and also herb like tauren to release blood stasis. So three part, clear heat with lugan and drain dampness and heat, yiren and dongguaji, and invigorate blood with tauren. As you can see in its name of the formula, lugan is the king herb. Action, clear the lung heat. And indication, lung abscess, coughing, foul-smelling yellow sputum. Can you see the heat? And pus and blood. So when you see the pus and coughing, think about this formula. Pus. Pus directly indicates the abscess. Pus and blood. So when you see this pus and blood in the question, consider this formula Jing Tang first. And various stages of lung abscess either before or after the formation of pus. Red tongue, heat, yellow, heat and dampness, right? Heat and dampness. And slippery, phlegm, dampness, rapid heat. That is Jing Tang. Another formula for metal, intestine and respiratory. In this case, Da Huang is used, not Jing. Jing goes to upper and Da Huang goes to lower. So Da Huang is a laxative. And Mudanpi clears heat and promote urination. So Da Huang, Tang. And also clears blood stasis by cooling the blood. And second, Changchi Tang, Da Huang Mangshao, and invigorating blood herbs like tauren and Mudanpi. Actually, Mudanpi clears heat of the blood. So the same dongguaji to treat the dampness in the intestine. And Da Huang Mangshao work as a laxative. And tauren remove blood stasis, and Mudanpi cools the blood. So stop bleeding by cooling blood. Mudanpi. Action, release damp heat in the intestine. So Jing Tang, damp heat in the lung. That is how Jing Tang treat lung abscess. And this is how this Da Huang Tang treat abscess in intestine. So excess damp heat intestine. So abscess. Pain that decreased with crouched. What is the sign? Peritonitis. Okay, rebounding tenderness. So when you palpate abdomen, when you release your hand, there's a pain. That is rebounding tenderness. That indicates the peritonitis, 복막염 peritonitis. Rebound tenderness occurs when tissue that lies in an abdominal cavity, 복강 내 peritoneum 안쪽에 inside the peritoneum is irritated, inflamed, and infected. This is called peritonitis. So rebound tenderness is an important sign for peritonitis. And pain that decreased when crouched, like appendicitis, peritonitis. And fever, perspiration, aversion to cold. If this condition is with your family, just call 911. This is my sincere recommendation. So enteritis, intestinal abscess, appendicitis. Can you see these conditions? And actually, in your office, you will have a chance to use Huang Tang with enteritis and hemorrhoid. Actually, hemorrhoid. So I use this formula for hemorrhoid patient. And if Huang is decocted for more than 1 hour, actually lasts a little bit more than 30 minutes, half an hour, the purgative effect is decreased. Based on research, after 30 minutes, it goes down dramatically. The effect goes down dramatically. So if you use this formula for hemorrhoid, you may cook shortly to loosen the defecation. So it depends. So if you need your patient have a loose stool, decoct shortly.